I'll just give a couple more minutes for anyone who wants to join to come onto the Facebook Live. Okay, we'll shortly get started. Right, so today's live is about exercise prescription. I'm going to cover how training should be tailored around specific goals that anyone might have, and how this can change during injury, because when we have an injury, obviously we can't train as we usually would. So to start off with, I'm just going to talk about kind of around how training is split into three general goals. So the training goals of someone will determine the types of exercises they do, the sets and reps they do, the load, the frequency the frequency of training throughout the whole week. So most people will have a general idea of what they want to get out of the gym or their training, be that a sport. But when it comes to planning for their goals, this may be an area that's not given that much attention. Now, a big proportion of people may just turn up to the gym and train whatever they feel like training on the day. Now, this can lead to certain body parts getting more attention than others, and potentially may lead to imbalances when it comes to strength, control, and the general size of muscles as well. Because if we're not training a certain body part and we're training others more, then we're getting more attention to, we're getting a bias to the ones that we're training more. Now, having a proper plan and planning and organizing will allow for a more structured approach to training and give more organization and routine to training as well. Now, this may enhance motivation as we're going to have a clear goal and a path towards achieving that goal. Okay. So there's many ways to split an exercise program, and what you decide will also depend on your specific training goals. In this video today, I'm just going to go over the two most popular splits that people tend to follow. And these can be used in most cases, such as recreational athletes, as well as active individuals who just want to get fitter by going to the gym. Now, the two most popular training splits are push-pull legs, so splitting it up into three different movements there. So pushing movements, so you have sort of chest, shoulders, and triceps on that day in push. In pull, we're going to have back and biceps, and during legs, obviously, that's your leg day. That's one split. Another split is an upper and lower split, where you're just splitting your training between upper body and lower body, and you're hitting those frequently throughout the week. Now, both are good ways to set up a training program, and they both allow for all major body parts to be hit at least once a week. And you want to make sure that you've got at least one multi-joint exercise, such as a squat, a deadlift, a military press, or even a clean and jerk in almost every workout. Now, this is a good idea as multi-joint exercises are more effective for increasing general strength as they enable more weight to be lifted during an exercise. This is because we need to recruit multiple muscle groups at once to perform these movements. So now, in terms of specific goals, in general, there are three main things that we can train for. So one is strength, and strength has subcategories of maximal strength or power. One is hypertrophy, meaning muscle size. And thirdly, we can train for endurance, which focuses on maintaining your output over a longer period of time. So now I'm just going to flip over to a research paper which looks at what we need to have in terms of our specific training parameters when we're training for each goal. So if our goal is muscular endurance, so if we're training for endurance, this means that we're going to work through 1 to 3 sets times 15 to 20 reps for each exercise. So we're keeping the sets relatively low at 1 to 3, but our rep range is high at 15 to 20 repetitions. Now, in terms of rest between sets and between exercises, we want to be resting for at least a minute, okay? And we are going to the gym or doing our endurance exercises 2 to 3 times per week. Now, if you want to train for hypertrophy, meaning you want to train to get physically bigger, make your muscles look bigger, make them look more toned, we are changing our parameters. So now we are changing to 4 to 6 sets, so higher sets, and we're doing 8 to 15 reps per set. Again, so you want to include large and small muscles within these kind of training programs. Now, our rest for this specific training goal should be 1 to 2 minutes between sets and between exercises, but we're going to the gym more than we would be when training for muscular endurance. So if you're training for hypertrophy, if your goal is to get bigger, you need to be going to the gym 3 to 5 times a week, or doing your exercises 3 to 5 times a week. Now, when it comes to power and strength, we have 2 categories. One is maximal strength and one is power. The only kind of way that they differ is if we're training for maximal strength, we want to be doing 3 to 5 sets per exercise and you're doing 3 to 8 repetitions. Whereas if we're training for power, we're still doing 3 to 5 sets. However, we're doing only 1 to 3 repetitions because you're working closer to your 1 rep max, okay? You're going up until 90% of your 1 rep max. So when training for maximal strength, we want more rest between sets and exercises. So around 3 to 5 minutes of rest is recommended, rest periods. And if we're training for power, we're resting even more, 5 to 8 minutes between sets, because you need to regain that oxygen to the blood supply. And we are training 3 to 5 days per week or for maximal strength and 4 to 6 days per week for power. So those are kind of the main parameters that we're looking at when we're training for each different goal. So as I said before, the training goals can be either specific to endurance, hypertrophy, or strength. Whichever one you choose is up to you, and you can kind of change the parameters depending on what you choose. Now, we also want to include a mixture of exercises within our training programs. And there's 2 kind of main movements that I want to talk about also. So we have concentric exercises and eccentric exercises. Now, concentric exercises just mean that the muscle is shortening during a movement. So during a bicep curl, my bicep is shortening. However, when I'm coming out of the bicep curl, when the arm is descending, my bicep is lengthening. So that is an eccentric movement because we've got tension during a lengthening action. When it's concentric, we are shortening the muscle and we're getting tension during a shortening movement. So you want to make sure you've got a mixture of the two in your training programs. Okay. In terms of speeding up your workouts, so some people don't have much time to spend in the gym and they want to speed up their workouts. One way you can do this is use supersets. So that's just jumping straight into another exercise once you've finished one, no rest at all. When you're doing this, it's important to make sure that 2 exercises that you're combining for a superset are for 2 different body parts, as this will maximize the output during each exercise. If you're supersetting 2 chest exercises together, it's very likely that your chest will get too tired during the first exercise to have the same amount of output during the second exercise that you're supersetting it with. Should make sense, right? And in terms of rest periods in general, we are aiming for 1 to 4 minute rest periods between sets. Resting less than this has actually been shown to have detrimental effects for increasing muscle size and strength. So make sure you're getting enough rest between your exercises and between your sets. Now I'm going to move on to talk about what we do during an injury, because obviously your training will change during injury. You can't train at the same level and intensity and do the same exercises as you were pre-injury during an injury. So generally there will be some form of a rest period where you're deloading, or you may need immobilization, meaning stopping movement altogether, depending on the severity of your injury. So the amount of exercise you will be doing will have to be reduced and altered depending on your limitations. Okay. Now, generally, the pattern of recovery after an injury tends to start with rest and managing your symptoms. So if we've got very, very high pain levels, a big amount of swelling, bruising, pain during walking, we need to, one, stop weight bearing and stop putting weight through that joint. Two, manage our symptoms, for example, using pain relief such as anti-inflammatories, painkillers, ice, compression, elevation. Okay, so this is your acute injury management protocol. Now, following this initial period of rest, and even during it in some cases, you can then use light active movement to get the affected joint moving. This will promote a muscle pump and a reduction of any swelling and stiffness within the joint. Okay, so moving the joint around is going to ensure that we're moving any kind of swelling around, and we're kind of reducing it and promoting lymphatic drainage of any swelling in the area. So movement will also ensure that our ligaments, tendons, and peri kind of structures around that joint are not getting stiff during this period of time. So once you've kind of had the period of rest, you've had the period of active movement, we're now going to move on to trying to put weight through that joint. So you now want to increase the amount of load going through that joint to get the structures used to having load going through them again. So your tendons, muscles, bones, ligaments, all the structures need to have a progressive kind of exposure to load going through them again, because we don't want to abruptly return to activity and re-injure ourselves. They're not used to the amount of load going through them. Okay, so you need to progressively do this and slowly return back to activity. Now, this is the period where we need to adapt the strengthening we're doing. So what we call isometric strength exercises means that we're getting tension, the muscle is contracting, however, it's not changing in length. Okay, so isometric exercises are really, really good in the early phases post-injury to start strength training, because they promote strength training but without the risk of injuring or aggravating an injury. So things like isometric hip extensions may be good for a hamstring injury, where you're pushing your heel into a wall or pushing your heel into the floor whilst lying down. You're not changing the length of the hamstring while doing this, however, you are using the hamstring during that movement. Okay, so isometrics of any joint are a good way to start your strengthening journey post-injury. And we're holding these contractions for around 10 seconds. Now, not only have these exercises been shown to be good for strength and starting strength training, they've also been shown to provide a little bit of pain relief after doing them during an injury. So if we're getting those two mechanisms out of this type of exercise, that's a win-win. So once we've kind of had, say, a couple of sessions doing isometric exercises, and we get really, really good at those, and we're getting a reduction in symptoms in terms of pain and functional deficits, then we want to slowly move into introducing concentric exercise, meaning we are actually moving the joint and we're shortening the muscles during those movements. Okay, so we move into concentric exercises, and we also start to move around more, we start to weight bear more, we start getting a little bit more confident using those joints and exposing our structures to load. Okay, now this is going over a period of time over about probably 2 weeks up to now, okay, after an injury. generally speaking. Obviously, each injury will differ in terms of time frames, and I can't tell exactly how much time you should be um, allowing for a certain period, a certain injury. In general terms, we move on to strength after the period of kind of immobilization and rest. So move on to strength, and then you're going to progressively increase the amount of load you're exposing those structures to. Eventually, you're going to want to return to plyometric activity, things like step ups and jumping up onto a box, as well as landing. Now, this is the later phase of kind of injury recovery, where we've reached the point where our strength is good. We're not getting symptoms on low level activities, okay? And we're starting to push into higher intensities. So things like box jumps and landing and double leg kind of landing mechanics we're going to look at. So landing from a box is actually a pretty good exercise to do post knee injury potentially, and things like an ankle sprain it's also relatable to, things like that. Okay. Now, in terms of allowing time for any strength gains to be seen, as I said, the time frames will change and will vary depending on injuries. Okay. Um, so I hope that gives you an insight into how to manage your training programs during an injury. Okay, it's just the fact that you need to tailor it around to your limitations. You won't be able to do everything you could pre-injury. And I hope it gives you an insight into general training programming in terms of the first part of the video, where I talked about kind of your three specific goals and how you change the parameters of your workouts during those. I will allow some time for any questions to be asked, and I will do my best to answer any questions that anyone might have. Okay, I think there's no questions. Thank you very much for listening and have a good rest of your evening.